then it's very important what kind of leader you have for that group, whether well-being is, prioritized, whether it's part of your, your like strategic plan, all of that stuff, right?
I'm Janae Sharp. Welcome to Sharp Conversations, where we talk about physician mental health and about burnout and whatever you think is important. We want to make sure that the voices of physicians and experts are included in conversations about healthcare.
Rebecca, we're excited to have you here. And yes, Janae, Rebecca and I know each other from residency, although I will be honest and say I have the world's worst memory and I don't remember a whole lot from residency other than being
Maybe that's a good thing.
Really tired and burnt out.
Yeah, you were a new hospital medicine attending and I was a resident, and I would say I was peripherally aware of your work in health IT because we're working on handoffs and such, and you were very pregnant.
Well, we are excited to talk to you, and to kick it off, I'd love to ask you, I know that in the midst of the pandemic, you were kind of thrust into the position of leading your hospitalist group. I'm sure your perspectives, your experience going through it was unique, but also your perspectives on how it was affecting your staff and your clinicians must have been really, one that we don't all see. And I'd love to give you, I don't know if you want to kind of summarize or have any highlights of things that came out of that.
I think another bucket is the wow, leadership, especially in hard times, involves lots of skills that we don't learn as part of physician training. And so how do we deal with those potential knowledge and skill gaps when we are in positions of leadership, especially when we're accountable for the well-being of other people, not just ourselves, right? And I've been to a bunch of sessions at conferences which are sort of introducing this idea of QI for well-being. And for me personally, I think, it was almost novel for me to think that was a novel concept for other people, because I think, right? Because I just think about these things as shared methodologies to solve complicated problems. So things like how you create relationships and engage stakeholders, things really searching for the root causes of problems, approaches trying to change things iteratively, trying a thing, did it work, then take it further, and then, reevaluate, and kind of going through that process over and over again. Those were sort of how I thought about my work already, and then had to kind of transfer that approach just to this very novel and sort of extreme circumstance of working with a hospital medicine group in the early days of the pandemic.
It's interesting to hear about it operationally as a group. I'm used to thinking about it operationally with patient care, right? That who's doing what, when, why, where for a patient. And so much of that communication, whether it's email or text messaging, is very piecemeal. So it's interesting to see that the same or a very similar solution in the operational side of let's put it all in one place where you can find it was so helpful, because then you don't have to figure out where to go find information, you know where to look. But yeah, I remember those first days also just felt so unknown. And I would wait for that email every day to be okay, so what do I need to know today about what's going on?
Right. We sort of considered the manual, which is where everything ended up once we felt like we had a solid enough answer to put in there, that it was going to be our single source of truth. And it really was our single source of truth for COVID treatment, but really COVID treatment and the operational things, which I think, again, just taking it back to that context, right? There was a treatment manual that kind of say steroids, yes, no, remdesivir, yes, no. But we were wait a minute, which kind of Q-tip are we sticking in the nose and which kind of Q-tip are we sticking in the mouth? Where is that information? And we wanted it all to be in the same place so that you didn't have to go check the Q-tip announcement, but also the steroids announcement.
Rebecca, is there anything you can point to that you were man, this really, I know you talked about communication and having a wiki, but anything else that you feel helped with just people's mental health? I know you talk a lot about social media and connection there and other things. Can you think of something that you were that either really helped?
So Jefferson was going through some really interesting times on this. One of the things that I was involved in before the pandemic, so there were inklings of Jefferson starting to be like, ooh, we really need a well-being strategy, and we don't really have one. So there wasn't a strategy, and we really started thinking about like, what's our, conceptual framework for well-being. We went with SAMHSA's, I can't remember even now what it is, 7 domains, I think, for well-being. Like, what are our programs? We had a retreat, did a lot of sort of foundational work to try and figure things out. And then the pandemic happened, right? And one of the effects of the pandemic was to make this like so obviously a need. I think we really just like doubled down on like our professional identity in some ways. Like, what is it to be a hospitalist? What is it to be a physician and a nurse practitioner? Like, what are the core driving values that like make us want to come to work in the morning? And we really sort of like built our future plans around the division about things like, advocacy, like health equity, but also the importance of like sustainability in the job. Like, we made those priorities really, really clear.
I guess one of my follow-up questions then is, do you feel like you were able to, support those core values? Because a lot of what I hear is from people is, I want more time with my patients. You mentioned advocacy and health equity. Was there enough alignment on the health system side to be able to support things you wanted to do to support your clinicians and their core values?
I think that, I'm a real like systems person. Like, I want to like create a diagram for everything. So I'm like, okay, so what you have over here is like the importance of listening, right? And like a lot of that is built on trust, right? Because people aren't going to tell you what they think constructively if they don't trust that you're going to use that information to get something done, right? So, I mean, on one hand, I think a benefit I had in this whole period was, it's very hard to step up as a peer into a leadership position. But in this situation, I think it worked because I personally had, a lot of trust capital with my group. And, I think if we had our division director leave and a new person come in from the outside who didn't have the relationships and this sort of, again, that like, my group knows, like, if they bring something up, I'm not gonna, like, I may not agree, but I'll give the idea like a minute of life. And like, if it's important, I may not be able to accomplish it, but I will take it to the people who need to consider it. And see if we can take action. So it doesn't mean like everybody gets what they want, but it's built on a foundation of like trusting that you're going to be listened to and that will be acted upon in some way.
I mean, I think that absolutely has to do with wellness, right? It's that we have lives outside of what we do in our careers, and they matter. And being able to make space for them and, not make someone feel bad about it is a big part of making them feel like they're supported at work.
Another thing that we did, and I stole this from Hopkins Bayview in some ways, so I have to give them credit. But we organized really our like priority areas in our work around 3 buckets. So one of them is joy, one of them is like clinical work, and the other is academic. So we've moved our COVID wiki into a like Teams site for the division, and there are 3 channels. There's joy, there's clinical, there's academic, and we put our resources and whatever in those folders. When I now send out a Wednesday email, not everyday email anymore, to the whole group, that has to do with updates, announcements, new initiatives. It's organized into joy, clinical, and academic. So, I think like building the idea of well-being into just like our entire organizing framework in a very low-key way, right? Like, this is not a like give me a medal for creating like an email with a section called joy. It's just like it's acknowledged that that's important and communicated consistently.
talk at all about social media and social interaction online? Like, did that help or not help, or any insights on that in terms of wellness during the pandemic?
Yeah, I have a lot of, I mean, you and I interact in the Twitter world. We have joint friends who we know from that, initially from that world. I really think that it's a highly personal question, right? Because the extent and like quality with which people
Right.
want to interact with social media just like really depends on what they've decided that venue, like how it serves their life and their well-being.
It's really important, I think, for people to hear a frontline clinician's perspective, which just doesn't get talked about, I think, enough in a way that people hear it. So I'm glad to hear of more and more people doing that, because it's really important.
Well, and I think you can take all of those people as examples, right? Like the process of writing something out in the long form and really solidifying like what is your opinion and what is your argument and like what is your truth about this issue, that allows you to be active in social media environments like with, I don't want to say less risk, but at least like you're not shooting from the hip, right? Like you have like, this is my consistent like body of knowledge, my area of expertise, my well-honed opinion, and I'm going to use social media to get that out there, as opposed to like the offhanded tweet that's like, my institution isn't keeping us safe. And like, that's not necessarily like an effective way to use, I think that's what we saw, Janae. I don't know if that's what you were sort of referring to when thinking about like who had voice and who didn't have voice and where social media manifested. But I think those are the tricky bogs, right? Where you can get stuck. And the first was like the, deaths from COVID. And then it was like, the deferred care. There were many. And I think like we're just not, I don't even mean the different peaks of COVID. I mean like all the downstream. And I think like this is all just part of that, continuing ripples of this really like cataclysmic event, right? I mean, I think those sort of concentric ripples, like dropping a stone in the water, is an apt, metaphor, because
And find people to be on your team who do have those expertise. I don't think it's feasible for one person to know how to do everything.
right.
I mean, except for me, and you.
Can I throw out a weird, maybe like contentious comment that I wonder about a little bit? When it comes to like gender, like, like gender in healthcare, right? So in leadership specifically, I think that a lot of the experiences that are super measurable and easy to articulate, like hiring and recruiting, managing a budget, I don't know, think of a couple others, are things that like maybe traditional leaders who are more often men like get experience doing, and then when they sit down at an interview they can be like, oh, I can do this and this and this and this. And some of the other skills that it takes to lead effectively, like emotional intelligence and listening and communication, those things are a lot harder to like prove that you're good at.
I wonder, I mean, you said it was a contentious comment. I don't feel like that's really contentious, but I do think that I wonder if there's a difference in gender amongst clinicians in what skills they do learn early. I mean, I feel like most people I know who went through medicine didn't really learn things about budget and financing and things related to actually running a department, but I don't know for sure because I have a small N.
Right. Well, and as you said, like not about leadership, but I do think one of the things, I guess my tie back there, which may be obvious, is that if you're looking at well-being at the community level, right, as opposed to like what's impacting my well-being today, but rather like what's impacting the well-being of my division, then it's very important what kind of leader you have for that group, whether well-being is prioritized, whether it's part of your your like strategic plan, all of that stuff, right? And whether you're effective
whether it's resourced.
Right, whether it's resourced and whether you're effective at like actually, bringing those plans to bear, right? So I think there is a leadership component to well-being, especially when you're looking at like a community that has some kind of like hierarchical structure. So what is contentious? I think what the potentially, controversial part of that comment is like that men like are given the opportunity to build those skills like faster or with more frequency than women are. And I wonder, I think it must be, although I don't know.
I think it's true. I don't think that's contentious.
That's data backed.
I think that, you're right. Some people might find it contentious. I accept it as true. And when you look at the data, when you look at data around who's promoted, who's not promoted, I didn't learn this stuff until I had to run a business, right? And even then, I'm leaning on a partner who has expertise in that area, but I'm learning, a lot that I never would have had to learn had I not been in this position. But in all the prior work I did, I was never in a position where I had to manage any kind of budget. And it is true that, men are promoted more often, and so they're forced to learn those skills earlier, which means then they can talk about it in a better way.
And just everything that happened. I do have a closing question. It is, what do you hope to see in the future?
Well, it's not even physicians and patients. It's so like, it's all so big, right? Like, it's sort of like people should be able to live like healthy and fulfilling lives. And that goes for like people who are sick, who need to get better or be treated. And it goes for the people who are caring for them. The more we commoditize medicine and turn it into this sort of like factory mentality, the more we lose the like heart of what we're doing. And so I think my hope for the future is that we really reinvest in the heart of being in a caring profession, and recognize that that's how we're going to be able to like effectively take care of patients, but also like remain in this job ourselves. And I think we can do that by also doing like math and metrics and all the stuff. Like, we can still be like rigorous in our approach to that. We just have to remember that like we all show up to work for a reason, and that has to feed our soul just like it does, make people better.